Hi guys, welcome to the Healthcare channel. In today's video we'll be talking about how much is physical activities is recommended. In adults aged 18 to 64, physical activity includes leisure time physical activity, for example, walking, dancing, gardening, hiking, swimming, transportation e.g. walking or cycling, occupational i.e. work, household chores, play, games, sports or planned exercise, in the context of daily, family, and community activities. In order to improve cardiorespiratory and muscular fitness, bone health, reduce the risk of NCDs and depression, adults aged 18 to 64 should do at least 150 minutes of moderate-intensity aerobic physical activity throughout the week or do at least 75 minutes of vigorous-intensity aerobic physical activity throughout the week or an equivalent combination of moderate and vigorous-intensity activity. Aerobic activity should be performed in bouts of at least 10 minutes duration. For additional health benefits, adults should increase their moderate-intensity aerobic physical activity to 300 minutes per week, or engage in 150 minutes of vigorous-intensity aerobic physical activity per week, or an equivalent combination of moderate and vigorous-intensity activity. Muscle strengthening activities should be done involving major muscle groups on 2 or more days a week. Information sheet, Global Recommendations on Physical Activity for Health 18 to 64 years old. For further information click below and download the complete document, Global Recommendations on Physical Activity for Health, available in Global Recommendations on Physical Activity for Health. Physical activity for all these recommendations are relevant to all healthy adults aged 18 to 64 years unless specific medical conditions indicate to the contrary. They are applicable for all adults irrespective of gender, race, ethnicity or income level. They also apply to individuals in this age range with chronic non-communicable conditions not related to mobility such as hypertension or diabetes. These recommendations can be valid for adults with disabilities. However, adjustments for each individual based on their exercise capacity and specific health risks or limitations may be needed. There are multiple ways of accumulating the total of 150 minutes per week. The concept of accumulation refers to meeting the goal of 150 minutes per week by performing activities in multiple shorter bouts, of at least 10 minutes each, spread throughout the week, then adding together the time spent during each of these bouts, e.g. 30 minutes of moderate-intensity activity 5 times per week. Pregnant, postpartum women and persons with cardiac events may need to take extra precautions and seek medical advice before striving to achieve the recommended levels of physical activity for this age group. Inactive adults or adults with disease limitations will have added health benefits if moving from the category of no activity to some levels of activity. Adults who currently do not meet the recommendations for physical activity should aim to increase duration, frequency and finally intensity as a target to achieving them. Benefits of physical activity for adults overall. Strong evidence demonstrates that compared to less active adult men and women, individuals who are more active have lower rates of all-cause mortality, coronary heart disease, high blood pressure, stroke, type 2 diabetes, metabolic syndrome, colon and breast cancer, and depression, are likely to have less risk of a hip or vertebral fracture, exhibit a higher level of cardiorespiratory and muscular fitness, and are more likely to achieve weight maintenance, have a healthier body mass and composition. For most healthy adults, the Department of Health and Human Services recommends these exercise guidelines. Aerobic activity. Get at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity a week, or a combination of moderate and vigorous activity. The guidelines suggest that you spread out this exercise during the course of a week. Greater amounts of exercise will provide even greater health benefit. But even small amounts of physical activity are helpful. Being active for short periods of time throughout the day can add up to provide health benefit. Strength training. Do strength training exercises for all major muscle groups at least 2 times a week. Aim to do a single set of each exercise, using a weight or resistance level heavy enough to tire your muscles after about 12 to 15 repetitions. Moderate aerobic exercise includes activities such as brisk walking, swimming and mowing the lawn. Vigorous aerobic exercise includes activities such as running and aerobic dancing. Strength training can include use of weight machines, your own body weight, resistance tubing or resistance paddles in the water, or activities such as rock climbing. As a general goal, aim for at least 30 minutes of moderate physical activity every day. If you want to lose weight, maintain weight loss or meet specific fitness goals, you may need to exercise more. Want to aim even higher? You can achieve more health benefits if you ramp up your exercise to 300 minutes or more a week. Reducing sitting time is important, too. The more hours you sit each day, the higher your risk of metabolic problems. Sitting too much can negatively impact your health and longevity, even if you get the recommended amount of daily physical activity. Short on long chunks of time. Even brief bouts of activity offer benefits. For instance, if you can't fit in one 30-minute walk during the day, try a few 5-minute walks instead. Any activity is better than none at all. What's most important is making regular physical activity part of your lifestyle. Physical activity guidelines for adults aged 19 to 64. Adults should do some type of physical activity every day. Any type of activity is good for you. The more you do, the better. Adults should aim to be physically active every day. Any activity is better than none, and more is better still. Do strengthening activities that work all the major muscles, legs, hips, back, abdomen, chest, shoulders and arms on at least 2 days a week. Do at least 150 minutes of moderate intensity activity a week or 75 minutes of vigorous intensity activity a week. Reduce time spent sitting or lying down and break up long periods of not moving with some activity. You can also achieve your weekly activity target with several short sessions of very vigorous intensity activity, a mix of moderate, vigorous and very vigorous intensity activity. You can do your weekly target of physical activity on a single day or over 2 or more days. Whatever suits you. These guidelines are also suitable for disabled adults, pregnant women and new mothers. Make sure the type and intensity of your activity is appropriate for your level of fitness. Vigorous activity is not recommended for previously inactive women. What is intensity? Physical activity is anything that moves your body and burns calories. This includes things like walking, climbing stairs and stretching. Aerobic or cardio activity gets your heart rate up and benefits your heart by improving cardiorespiratory fitness. When done at moderate intensity, your heart will beat faster and you'll breathe harder than normal, but you'll still be able to talk. Think of it as a medium or moderate amount of effort. Examples of moderate intensity aerobic activities: brisk walking at least 2.5 miles per hour, water aerobics, dancing, ballroom or social, gardening, tennis, doubles, biking slower than 10 miles per hour. Vigorous intensity activities will push your body a little further. They will require a higher amount of effort. You'll probably get warm and begin to sweat. You won't be able to talk much without getting out of breath. Examples of vigorous intensity aerobic activities: hiking uphill or with a heavy backpack, running, swimming laps, aerobic dancing, heavy yard work like continuous digging or hoeing, tennis, singles, cycling 10 miles per hour or faster, jumping rope. Knowing your target heart rate can also help you track the intensity of your activities. For maximum benefits, include both moderate and vigorous intensity activity in your routine along with strengthening and stretching exercises. What if I'm just starting to get active? Don't worry if you can't reach 150 minutes per week just yet. Everyone has to start somewhere. Even if you've been sedentary for years, today is the day you can begin to make healthy changes in your life. Set a reachable goal for today. You can work up toward the recommended amount by increasing your time as you get stronger. Don't let all or nothing thinking keep you from doing what you can every day. The simplest way to get moving and improve your health is to start walking. It's free, easy and can be done just about anywhere, even in place. Any amount of movement is better than none. And you can break it up into short bouts of activity throughout the day. Taking a brisk walk for 5 or 10 minutes a few times a day will add up. If you have a chronic condition or disability, talk with your healthcare provider about what types and amounts of physical activity are right for you before making too many changes. But don't wait. Get started today by simply sitting less and moving more, whatever that looks like for you. Please don't forget to subscribe to our channel for more recommendations on health, relationship, lifestyle and other helpful information to form life easier.